Hi, my name is Catherine, I'm a PA student. Today we're going to be doing breast exams. I have with me fellow PA student Taylor, and she's going to be assisting with some of it. So first things first with our patient, we're going to go ahead and start with the introduction and the consent. So hi, my name is Catherine, I'm a PA student. Confirm your name and date of birth. So today we're going to be doing a breast exam that involves some palpating to feel for any masses or changes, and also to make sure that there's no rashes or anything like that going on. I have a chaperone here with me, so Taylor will also act as my chaperone during this exam. Do you feel comfortable proceeding with the exam? Once we get consent, we'll make sure that they're changed into an appropriate gown with no bra. So to start the exam, the first part we'll do, Taylor will also be doing it on the other patient with me. Oh, I was going to part. Oh, we'll do it together, whatever. So first I'm going to have the patient move their gown so I can visualize both breasts at the same time. So we're looking for size, shape, symmetry, any skin changes, any rashes, any lesions. To start, we'll have them sitting up. We'll have them also do the position changes of putting their hands on their hips and then putting their hands above their head. In doing so, it moves the muscles so we can get a better visualization of the skin for any other changes. At this point in time, we're also doing a quick observation for any nipple retraction, and at this point in time we're going to have them recover themselves back up, and then we will have them lay down, and while in the supine position we're going to do the palpation on one breast at a time. So we'll have them uncover, and the side that we're doing we'll have them put their hand above their head. So at the same time I'm doing this, I'm going to have Taylor do it on her model as well. Because there's a couple different ways to do it. So the method that I like is, it was described to us as a clock method. So you're going to take one hand and using two fingers, move from the outwards edge to the nipple border for the areola, and then move to the next part of the clock. So if that was 12 o'clock, that's 1 o'clock, 2 o'clock, continuing all the way through and all the way around. And Taylor's going to show you the circular method.
Yes, and I would also have gloves on, just to be clear, and I have washed my hands. So I like the circular method where we start from the outside. So I use about 3 fingers. I'm going to place my hand here. I wouldn't do that in real life, but the model does move. So I'm going to place my hand here just to keep the model still, and then I'm going to be rolling in, and I'm just applying pressure to make sure I can feel for any lumps, lesions, or masses. And you just want to make sure you go all the way around the outside tissue, and then I go up to the
Tail of Spence as
tail
well.
of Spence, and then you're just going to keep working your way inside. Also asking for any pain, because the patient will feel pressure with this, but they shouldn't feel pain unless there's an area of tenderness. And then just going around the nipple. I did get out here, but you just want to reiterate that spot because it's often missed.
And during this exam, so for example on this model it does have some pathology, so there was a mass in this area. Something that is important to do is when you note the mass, make sure you continue with the rest of your exam, but you will want to make sure you document it. You also can compare, so I haven't done the other breast yet, but since there's a mass here, should see if there's another mass there. We can ask the patient if they regularly do breast exams, if this is new or abnormal. So once we have done that, we're also going to inspect the nipple and the areola for any color changes, any erythema, any rashes, any scaling, ask if they've had any discharge. We also can check for discharge, and the appropriate way to do that will be to apply your hands on either side and apply pressure to allow for any discharge to come out. The textbooks say to pinch, but in real life, let's make our patients comfortable and we'll squeeze. So then we will go ahead and do the same thing on the other side. So if you'd like to do your method as well again. So obviously I can't stand here, but for the purposes of the video, I'm going to go ahead and do the same. Making sure that you're talking your patients through all of the steps This is a good time for small talk as well, just because you are in a sensitive area and it's important for them to know that you're taking this seriously and you're not being weird about it and simply performing the exam. Also, if they've never done self-checks, this is a good time to explain to them as well how you're doing it so they can do it themselves. And then again, on this side, we would also express the nipple after looking at the nipple and areolar area. So the next step is, like I said, there were some masses noted. So there's one here. It's firm, nodular. It's in, we're going to use the clock, so a 2 o'clock position, probably 2 to 4 centimeters, 2 this way and like 4 this way, approximately. Smooth, rubbery. We could send them to get that checked out as well, especially if it's new and they're not regularly getting their mammograms. This one showed some nipple changes. If you want to talk about it.
Oh, okay. I was just going to describe, so you do have this lesion here. So I would say that that's probably between like 5 and 7 o'clock. I have measured my pinky from like here to here, which is about 1 centimeter. So I usually measure this way. So that'd be 1, 2, 3, 4. So but maybe like 4.5 centimeters, between 4 and 5 centimeters. We do have a term for the coloring of this in OBGYN, which is peau d'orange. And I would describe it as patchy, circular. It is textured, it does have some roughness to it. And then yes, you can see, as Catherine started describing, the nipple is inverted, and there does appear to be a little bit of a rash around the nipple, so I would just want to confirm by checking with the other side, and then also asking the patient if this is new as well. And then this is some dimpling here that we see, which can sometimes be, we just learned this earlier today, it can sometimes be an indication of cancer because the tumor will be attaching to that skin surface and pulling it in.
So then to finish up our exam, we'll have our patient kind of recover themselves, but we will check the lymph nodes. So we're checking the super and supraclavicular lymph nodes on both sides. And we did already go through that talus fence tissue, but we will also be checking the axillary lymph nodes, which is kind of hard with no arm here. But we'll do that as well. And then any abnormalities that we noted on the exam, we made sure to document. And throughout this exam, making sure that your patient is comfortable, that you're explaining what you're doing, and that you are providing the best patient care you can. Thank you.